Here is the equipment required. You need 3 sterile bottles, and make sure that beforehand you label them 1 to 3. These will be filled chronologically in that order. If red cells are found in the CSF sample, you can distinguish between true blood in the CSF or a traumatic tap by looking at the distribution within the 3 bottles. In a traumatic tap, the number of red cells will decrease progressively. We need 2 syringes, some sterile gauze, sterile dressing, needles, local anaesthetic, an alcohol swab, and dressing pack. The special equipment required for a lumbar puncture are the spinal needles and manometer. The needles are different colours which represent different sizes. The black is 22 gauge, yellow 20 gauge, and pink 18 gauge, pink being the largest and black the smallest. The manometer is used to measure the opening pressure of the CSF. It comes in 2 tubes and has a 3-way tap. It is important to assemble this before starting and to open and close a tap before measuring the pressure, as it can be quite stiff at first and difficult to do mid-procedure. Have the patient in the left lateral position with the knees flexed and the head bent forwards. Draw a virtual line between the iliac crests. This will go through the body of L4 or the L4-L5 interspace and ensures that you will miss the spinal cord, which ends around L1-L2. Try and palpate the spinous processes in the midline at this level. Make a mark where you will enter, just above the spinous process. Clean the area with your alcohol swab. After putting on your sterile gloves, draw up the local anaesthetic and check the expiry date. You must always check anything that you are going to inject yourself. Warn the patient of a sharp scratch as you infiltrate the local anaesthetic into the soft tissues, making sure to aspirate before injecting the local anaesthetic to ensure that you are not in a vessel. Infiltrate deeper along the tract that the needle will pass through. Whilst you're waiting for the local anaesthetic to work, you can assemble the rest of your equipment, particularly the manometer, which comes in a sterile bag. Connect the 2 parts of the tubing and the 3-way tap. Make sure to loosen the tap first. Ask an assistant to keep hold of the numbered bottles with their tops removed. They can hand these to you once you have obtained CSF. Making sure the stylet is in place, advance the needle bevel upwards, aiming towards the umbilicus. When the needle punctures the dura, there will be a slight give, which will become easier to notice with practice. At that point, you can remove the stylet, and the CSF should flow freely. It is common not to obtain CSF at the first attempt, and if this happens, the needle should be repositioned for a second attempt. Once CSF has been obtained, attach the manometer, and you can see the fluid rising in the manometer. When it stabilizes, you will see it rising and falling gently with respiration, and this marks the opening pressure. In this patient, it is about 20 centimeters of CSF, which is a normal opening pressure, and the CSF looks clear. Now fill the bottles in sequence, with a few mils in each bottle, including the glucose bottle. At this point, if you are performing a therapeutic tap, you can measure the closing pressure. Withdraw the needle and cover the puncture site with a sterile dressing. To finish the procedure, ensure that your sharps are disposed of, the sample bottles are labelled, and advise the patient to rest. However, it is generally not accepted that prolonged rest improves the post-lumbar puncture headache.